My name is Sheryl Skolnick. I am a Wall Street analyst. I'm co-head of research and a managing director at CRT Capital Group in Stamford, Connecticut. I've been coming to the Revive conference for several years now as a speaker and also as an attendee. So during 2013 and during 2014, as we've seen in other years, the publicly traded health plans have given us, and hospitals have given us, an awful lot to chew on and chomp on and to sit back and observe and consider as to whether or not they were perhaps truly absurd or perhaps fantastical events. This year we were treated to the sideshow that became congressional hearings and the disaster that was the initial startup of healthcare.gov, the exchange. And so one of the more interesting things that I thought came out of all of that was not just what seemed to be a witch hunt and going after the responsible parties within the government and the government's contractors for that disaster, but more importantly and more interesting was who was asked to come in as the White Knight in the shining armor, on the shining horse to save the day. And it ended up being a company called Optum. Now, for those in the know, Optum actually bought an entity that had the part of the healthcare.gov contract called QSSI. And it was actually QSSI who was the contractor, but in December of 2012, Optum bought QSSI. Optum, in turn, is one of the most important and fastest growing parts, I would say mission critical part, of United Health Group. United Health Group also has a benefits business. United Health Group's benefits business, you would think, if they knew so much about the exchange on the left-hand side of their business, maybe they'd be a participant on the right-hand side of the business. Or, alternatively, maybe because they knew so much that was going on the left-hand side of the business, they chose not to be a big player on the right-hand side of the business. So here's your little absurdity. United Health Group, United Healthcare, it's very, very large, perhaps the nation's largest benefits provider, health plan, managed care company, understands this business well enough to only participate in a handful of individual exchanges. 4, in fact. Out of all of the states, they only participated in 4. Yet it happens to be United's Optum and QSSI who rides in under a very tight time frame, acts as a general contractor, and actually saves healthcare.gov and enables all of those millions of people who signed up, whether they were previously insured or not, whether they're duplicates or not. There's still millions of people who signed up for insurance who will have it or do have it today who didn't before. And it's because of the one firm that happens to have a really dynamic Optum business that comes in and knows how to fix and actually whose mission, I think, in my words, is to fundamentally, permanently, and absolutely fix what's broken in the healthcare payment and delivery system. Now, the absurdity comes in with the fact that on the other side, in the healthcare benefits business, they happen to be, according to the Revive survey, the least trusted health benefits plan. So how do you have this absurd situation, an entity whose mission, who actually acts on that mission to save healthcare.gov, is working, it seems, very hard to preserve a system today that we know is fundamentally and absolutely broken because it maximizes near-term profits on the benefit side. So that's one point of absurdity that we've seen.